Kids see ads every day online and magazines and stores, reminding them that menthol cools smoke, makes it less harsh, easier to inhale, has a better flavor. Features that are deliberately engineered into cigarettes to make them attractive to new smokers and to make them more palatable. Every display of menthol products in a store is a reminder of this message. Reducing exposure to these messages will reduce the number of kids who try menthol products and will reduce the number who make the transition from first cigarette to becoming a regular smoker.
I have 12 grandchildren. Their ages are 13 to 2. And I hope I'll never get addicted. I've seen I do geriatric care. I've seen the results of long-time smoking. It's clear that menthol products help people get addicted. It's clear that teenage brains are very susceptible to addictive agents, including nicotine and alcohol. The easiest way to quit smoking is to never start.
We've come to the same conclusion, though, about Tobacco 21. It's the right step to take because we care about our kids. Edina will be the first, but hopefully not the last to enact Tobacco 21, and we can set an example. So before I turn to others, I'd like to just remind you that Tobacco 21 has been shown to work at the local level. Needham, Massachusetts passed this in 2005, and they had a 50% reduction in their high school tobacco smoking prevalence. That's a very significant change. We should be aspiring to do the same thing here in Edina. As a physician, a public health advocate, a community health commissioner, an Edina resident, and perhaps most important, a father of young boys, I urge each of you to demonstrate your commitment to our children's health by voting yes on the Tobacco 21 ordinance.
As part of my commitment to my patients, educating them on the dangers of these products is part of what I do. I'd like to second everything that everyone has said about the dangers of these products and the illusion of the flavored products, what it gives to an adolescent and developing brain. I mean, that brain does not have, kind of executive functioning and, frontal lobe abilities to know that what I do right now has consequences in my future.
Unfortunately, tobacco is still the #1 cause of preventable death and disease in Minnesota. Thanks to the measure before you today, we have an opportunity to substantially reduce the harmful effects of tobacco on our communities, families, and individuals. I've spent most of my career both studying and advocating for health equity. Although healthcare here in Minnesota is generally better than most states, we have among the largest racial health disparities in the country. Improving health equity requires addressing social determinants of health like housing, poverty, and education. These issues can be costly, time-consuming, and fraught with political challenges. This ordinance is unique because it is straightforward, low cost, and a timely policy that can improve health equity in our community.
We've seen a large increase in the price of cigarettes, and we've seen a significant decrease in consumption based on price and public information. It's my perception that the tobacco industry is selling a product and looking for a profit. These are publicly traded companies with shareholder ownership. They would like to get more of our youth interested in tobacco. So one of the ways that they do that is price. $10 a pack for cigarettes is a little expensive, and so the social sourcing is a little more difficult at $10 a pack. And then the flavoring. seems to be another draw for youth.